Hello, my name is Darush Attar-Zadeh and I'm a pharmacist based over in England, United Kingdom. I'm a community pharmacist by background, but these days I do more work in GP practices in primary care as an independent prescriber, specialising in respiratory. So I'm delighted to talk to you about the non-pharmacological approaches and lifestyle changes to support patients' self-care, particularly focusing on chronic bronchitis, which falls under the umbrella of COPD, also known as chronic obstructive pulmonary disease. So community pharmacists have got a valuable role to play as part of the multidisciplinary team. We always say in England, you're never more than 20 minutes away from a community pharmacy, really easily accessible. So it's great that we can offer things like very brief advice, for example, when it comes to smoking cessation, also known as treating tobacco dependency. We can offer the ask, advise and act. We can ask a person if they smoke, if they live with a smoker. We can advise the person that the best way to stop is with a combination of support and treatment. So that will depend on what you have available, of course, in your own country. But hopefully you'll have things like nicotine replacement therapies, which can normally be purchased over the counter, or you can get some prescription medications. So support and treatment is absolutely key, and the support might look like telephone support, or sometimes you may even offer telephone or face-to-face support too. So the ACT part of it is the signposting. So if the person's not interested, we can always say to the person, look, our door is always open for that support whenever you're ready to stop. It's very positive. And the final bit, if the person is interested, of course, you can signpost. So the ask, advise and act can also be used in other areas, non-pharmacological. So we could do that for, say, somebody with chronic bronchitis is experiencing breathlessness, cough, and they want to try and increase activity a bit more. That might be the last thing that's on the person's mind when they're experiencing a long-term condition and symptoms like that. But increasing activity is great medicine for that patient. It's really, really important that we try and signpost people to support that's available. For example, if somebody wants pulmonary rehabilitation, we can ask the person, how has their breathlessness changed their life? Open questions like that. We can advise the person that pulmonary rehabilitation helps you breathe better, feel better, do more. If the person works, they can return to work potentially, and we strongly recommend it. We can act and signpost to the support that's available. So these are just examples of many things we can do. So promoting vaccinations. We know that during the pandemic, the uptake of vaccines has been really good for COVID, for example. But we can't forget about flu and pneumococcal vaccinations too. If we can help the patient with chronic bronchitis get vaccinated, but also the population as well, that will protect them, it will protect their family, it will decrease hospital admissions and improve survival. But it will also, the good news is it's very well tested and there's excellent safety records. So using positive words like that with patients, I think would be really supportive. Let's not forget about self-management plans. Co-creating self-management plans so a person knows what to do to, if their symptoms, for example, are deteriorating, what to do. Self-management plans will also have details of their medication, but also details of, for example, the GP practice or other support that might be available. Let's not forget that long-term conditions like chronic bronchitis, a person may have multimorbidity as well. So depression is a very common multimorbidity. So treating the depression is going to be really important as well, and signposting to support the talking therapies, for example, that may be available, as well as medication, if needed, would be really, really useful. So hopefully you've got some key snapshots of how important our role is in community pharmacy and how we can help people live better with COPD. Thank you.